wanted to start by referencing a letter that I and I guess 14 other senators sent to you recently about the House bill, H.R. 1628, but in particular wanted to reference the Congressional Budget Office report that just came out on the 24th of May. Of course, this is a nonpartisan report by both the Congressional Budget Office, assisted by the Joint Committee on Taxation. And I just delivered to the table next to you there a copy of the CBO report so you could go to the page. I direct your attention to page 17 of the CBO report. On that page, the following statement is set forth there, quote, Medicaid enrollment would be lower throughout the coming decade, culminating in 14 million fewer Medicaid enrollees by 2026, a reduction of about 17% from current numbers. It then references this chart, which you see on page 19, showing the numbers going down for Medicaid over that time period between 2018 and 2026. All bars going down. I reference that in the context of what you said on CNN on May the 7th. Quote, and I'm quoting you now, and the transcript is right in front of you. Quote, there are no cuts to the Medicaid program, unquote. That's what you said. Do you still stand by that statement that you made on CNN?
The Medicaid program under the President's budget would increase by...
Secretary Price, let me just, yes or no? You can explain after that, but yes or no? Do you stand by that statement you made on May the 7th on CNN?
What I stand by is the statement that the President's budget...
Do you stand by that statement? That's a very, I think there are... What's
the baseline?
8 words.
What's the baseline?
There are no cuts to the Medicaid program. Do you stand by that statement?
What's the baseline?
I'm not...
If there are no cuts, it's relative.
You have the statement in front of you.
Yes, I stand by that statement.
Okay.
It's relative to something. And
go ahead, you can explain.
Baseline,
go ahead.
The baseline, if the baseline is today's amount of money being spent on Medicaid, the President's budget provides for an increase, CPI medical or CPI medical plus 1 increase in Medicaid spending for the programs.
So are you saying that the statement in the CBO report on page 17 is not accurate?
I'm saying that the statement on that the CBO made doesn't include the constellation of activities within the administration regarding how we would move forward on health care.
CBO says there'll be 14 million fewer Medicaid enrollees. So that's one.
Do you have?
Let me go to the next.
Do you have the CBO report on the ACA when it was proposed in 2010? Because what they said then.
No, what I'm talking about,
25 million individuals.
Talking about the House Republican bill that was passed. That's what we're talking about today.
And I'm talking about what the CBO did, because they had a similar graph about the number of individuals that would be covered now, and in fact they were in.
Let me direct your attention to the same CBO report you have in front of you, page 13. The top of that page, it says the following. The introductory sentence is a reduction, quote, the total deficit reduction includes the following amounts shown in Table 3 at the end of this document. The first bullet under that is, quote, a reduction of $834 billion in federal outlays for Medicaid. So do you still assert, in light of that, and in light of the previous CBO statement, you still assert that there are no cuts to the Medicaid program? You stand by that statement?
As you understand, it depends what
all I'm asking you to do, Secretary, is to tell us whether you stand by that statement or not. I stand by that statement. Okay. Finally, let me go to a statement that was made in the CBO report. Now I'm going to page 19 and 20 you have in front of you. At the bottom of page 19, the following is set forth. Quote, under the Act, meaning under the Republican bill passed in the House, under the Act, premiums for older people could be 5 times larger than for those younger people in many states, but the size of the tax credits for older people would only be twice the size of credits for younger people. As a result, and here's the first bullet point, for older people with lower income, net premiums would be much larger than under current law on average. And then it refers to Table 5 at the end of the report. So I ask you that in the context of another statement you made. Now this is Meet the Press in March the 12th, quote, you said that nobody will be worse off financially as a result of the bill. Do you stand by that statement?
I don't believe that statement was in reference to the bill. It was in reference to the health care plan that we've put forward, and I stand by that statement.
Senator, your time is up.
Well, I hope that you focus more on not just the proposed reforms you talk about for Medicaid. I hope you focus on people like the 15 million Americans that get Medicaid because they have a disability. We're all for discussion about making programs better, but I think you should focus more intensively on those people and be truthful when you're commenting about something as important to American lives as the Medicaid program. And I would argue, sir, you have been deliberately misleading based upon those statements.
Senator, with respect, that's precisely what we're focusing on. The American people have understand and appreciate that the health care system that we currently have for many of them is not working. Many of them in the Medicaid program, it's not working. And what we're trying to do, and we'd love to have your support, what we're trying to do is to make certain that we have a system that responds to the wishes and the needs and the health care needs of all Americans.
We all agree on that, but I think you have to start being straight with people about what will happen. These are major cuts. The CBO said it in more ways than one. I think you should be truthful about that.